Governor Murphy says that 73 long-term care facilities in the state, that's a majority in the state, have at least one COVID-19 positive case. That's the situation indoors. We already know how susceptible the elderly and immunocompromised people inside those facilities are to coronavirus. Outside, social distancing is still what he's stressing. We're here in Hoboken. I don't know if you can see the promenade behind me. A lot of people running and walking past one another. When they cross each other's paths, they are certainly not 6 feet apart. Governor Murphy continues to say that is the only way that we are going to flatten the curve here in New Jersey. Coronavirus and the disease it causes, COVID-19, continues to spread at an alarming rate across New Jersey. The focus on this Monday, the Lakeland Health Care Center in Wanacue, Passaic County.
I've instructed, not that she needed it, Judy and her team, to give full support to Mayor Dan Muller.
The nursing home is reportedly the location where 8 people have died of the virus, with several others presumably elderly and or immunocompromised individuals are also infected.
We know that lots of folks out there are worried about moms and dads, grandfathers and grandmothers who are in facilities around the state. We're doing everything we can to as aggressively get out ahead of this as fast as possible.
Governor Phil Murphy says there are at least now 198 confirmed COVID-19 deaths across the Garden State, against more than 16,000 confirmed cases. During his Monday daily briefing, Murphy once again drove home the importance of social distancing, arguing the aggressive policy, which includes an ongoing closure of all non-essential businesses, is what's currently staving off an absolute healthcare catastrophe.
My stay-at-home order remains firmly in effect. Unless you are absolutely needed to go out or unless your job is critical to our response, please, please, please stay home.
Still, the number of hospital beds and available ventilators is not matching the pace of the spreading virus, even as New Jersey rushes to open 3 additional regional field hospitals, the first opening up by the end of this week.
Our hospitals are quickly running toward full ventilator capacity. We are working with them to ensure the supply given what we know we have in state and what's on the way. Even knowing this, we are working with our hospitals and FEMA to allow them to co-vent or have 2 patients connected to the same ventilator.
Governor Murphy says that the state is currently trying to buy 2,000 ventilators on the open market and has already requested another 2,000 from the federal stockpile. All of that in the hopes that the state will not have to co-vent. As you heard Governor Murphy describe, that's 2 people running on the same ventilator. He says that if the state can successfully social distance, that could drive down the spike, the expected peak, by half. That's a big if.